I started my career in doing clinical trials a long time ago. And when we were sort of putting together a clinical trial, we had to go to each individual institution's ethics committee to get approval for a trial. So it would take forever because you'd have 10 or 15, trial centers, and getting ethics approval is very complex and takes a lot of time. So if you have to do this 15 times, it really impedes your ability to move ahead and start recruiting quickly.
One of my conditions is narcolepsy, and I know people with narcolepsy who were living in, northern Alberta, or the Maritimes, and they had to go out of province to find a specialist who was equipped to accurately diagnose and treat them with anything beyond sort of first line medications. If you're having to travel out of province to access care or to access clinical trials, what that means in effect is that care and clinical trials are only available to the people who have the economic means to do so. So really, when we're talking about geographic inequity, we're also talking about, financial, about socioeconomic inequity.
Clinical trials are extremely important to us. We want access to them. We want to be able to, benefit from all of the new advances in medicine. And we're just not going to be able to do that if we don't create that attractive environment where our ecosystem is welcoming and where we've removed barriers. I think there's a lot at stake if we don't implement that single research ethics review system. First of all, in the clinical trials world, that's where everyone is moving. So why are we not moving there? That would be my question as a patient.
And this is something that we should all want to get behind. This is something that's important for our country. Not only is it important in terms of effective health outcomes, but it's also important for science.